So, hi, my name is Fran Harris, and I am, as I said earlier, at LSHTM, the London School of Hygiene and Tropical Medicine. So I'm presenting today on something called Collaborate, which is a live social game. I wasn't part of the team that developed it, so I have to say I'm very much doing it on behalf of some Imana colleagues, as well as all the different institutions here that were involved in developing the game. But I've played it in other contexts, which I will explain later. So the aim of today's session, I should start actually just to say what we're going to do. Firstly, I'm going to give an overview of what actually Collaborate is. Secondly, I'm going to then look at a case study which was used specifically by Imana, where they developed it into something called Diet Dimensions. If you're interested, there's some booklets on the back table that further explain what Diet Dimensions is. Does this keep jumping, or is that, that's fine, okay. It explains what Diet Dimensions is and how it was used, but I will do a bit more as well about that. And then also just briefly discuss another example of how the game can be used, and then it's going to be your turn to play the game. It's a bit of a trial session in this way, but we'll see. Hopefully it will work. At least it will be a little bit of fun in the afternoon. We'll see. So what is Collaborate? Well, as we said, it's a live social game that aims to facilitate the shared development of new ideas. So it doesn't involve dice. All it involves is a group of people coming into a room together to discuss and develop new ideas. The aim is to foster interactions between groups that might otherwise not communicate, as well as develop actually innovative policies or project ideas, and also to encourage players to think and work in an interdisciplinary way through a collaborative and reflective process. So firstly, what happens is everyone comes together and forms teams. And through that, the idea is that they're as interdisciplinary as possible, which encourages the development of more holistic projects themselves. So interdisciplinarity is a very important part of this game. Then, like I said before, these interdisciplinary teams then form new projects or new ideas based around a different topic. And then finally, these different teams debate amongst other teams with the idea that that builds critical understanding and also obviously continues to share these ideas. The reason that you need such games, or that Collaborate was developed, is because policies, as we all know, are likely to have multiple impact pathways, and actually assessing these trade-offs and co-benefits can be really important in understanding what the implications of such policies are. So this interdisciplinary perspective is really valuable, and it can help build our learning. Furthermore, it's also useful to facilitate the dialogue between different people that work in different areas, and particularly for researchers, something we often struggle with is moving forward from just research on published paper into practice, and what does that mean in the real world? And games like this can really help us to discuss and understand how different perspectives and different stakeholders might view a problem. So that's just an overview of how the game itself works. Now I'm going to talk about the Diet Dimensions game specifically, which was developed with the goal of understanding or creating a project around sustainable diets and sustainable food systems, quite relevant to what the previous session was discussing this morning as well. Why does it work with the problem of sustainable diets? I'm not going to go into a full discussion here of what sustainable diets are, because that could have a whole other hour. But obviously, for those who were at least in the session yesterday, and I know that it's kind of a commonly used term now, they cover different elements of health, well-being, environmental sustainability, livelihoods, economic value, etc., etc. So there's all these different goals or targets that we're trying to achieve, while at the same time, sometimes if you achieve one, it means that you don't achieve the other. So there's these trade-offs that exist. That's really important, that you have to have a topic or a concept that you're trying to target which does have that multiple perspective. That's where the game works best. The game is played in, or at least in this context, the game was played in 8 steps. I'll go over each of these individually, but 2 of these steps happened not on one day, whereas the rest of them were all that day in the room. So just thinking about the practicality of how you would run this game. I should have actually said that at the beginning, is that we're obviously going to play the game today, or at least a shortened version of it, but I also want everyone to start thinking about how the game actually could be potentially implied in other contexts. So first step 1 was a pre-game questionnaire. And the aim of this was just to get an idea of exactly who the people were that were going to be playing the game. So for the people that are organising it, they can have a bit of an understanding of who's going to be in the room. Then the session went on to an overview of what sustainable diets are. So just in case there's people that don't necessarily understand what they mean, it gives people kind of the same level of understanding within the room. A bit like what I'm doing here today, or what we've done here this morning, where we're talking about managing different tools to use. We're giving you an overview of what they are. The next step, once people are in the room, is to each of the players complete something called a character sheet, where they have to fill out their own information on the sheet. And then they use this character sheet to start interacting amongst the room with different people in order to develop teams in what's known as the marketplace. This happens over about 5 minutes, so it's quite quick. And the character sheets will look something like this. Sorry, it's quite, I know it's very small for people at the back, but the character sheets contain different information about what background you might have, and obviously this would be tailored to the different contexts. And you use the information that you've got in that pre-survey questionnaire to know who's actually come along to this. Then you have the project formulation stage, where teams will sit individually and come up with these projects that are with the same goal of achieving sustainable food systems. And they can be in all sorts of contexts, all sorts of scales, levels. It can be international, local, it can be whatever you choose it to be, but the point is it's decided amongst your interdisciplinary team. You'll have something like this, which is called just a project sheet, that is aiming to help guide the teams to what kind of information you might want to be thinking about. And at this point, I want everyone to have a quick look on their tables, and you should all have a proposal sheet, which will be used later. So just if you want to have a quick look at that, I mean, you'll see it again in time, but that's the kind of thing that you're going to have to start thinking about later. So you can tailor these to the specific issues that you're asking about. Then you have something known as the battle stage, and the evolution of the projects themselves. And this is where Collaborate has a particularly important point, that you rather than developing your ideas over half an hour and then presenting them to the whole group, you will do it individually in your teams over 10 minutes, and then you critique and debate with another team on a small scale, but through that process it happens quite rapidly, and it really allows you to develop your idea and think, obviously quicker, but also think in an interdisciplinary way, and allows everyone to speak as well, because quite often, sometimes if you have a big group, you don't necessarily feel comfortable with everyone sharing ideas, whereas in this sort of format, it does support that. You will then, once this stage is ended, the projects are then judged, because obviously all good games have an end goal of a winner, and the projects will be judged on 4 criteria. Well, at least in this case they were for diet dimensions. 1 is interdisciplinarity, 2 is feasibility, 3 is adaptation to the project context, and 4 is the successful integration of critiques. And in this case, the participants weren't actually told what they were being judged on, and that apparently was quite good for people to kind of organically develop their own ideas and organically think about sort of how they wanted to take it forward. Then, this is, a very step-by-step process of what happens, but then the moderators would facilitate these battles and then actually judge. So there's always moderators that have to be in the room, so practically you always have to have enough people that are moderating the session. Then teams themselves, when they're actually doing it, they earn damage and critique points, etc. I can skim through this quite quickly, but and then notes are used to actually assess who's going to be the winner. Finally, the session must always conclude with discussion and feedback, as any good session does. And in this case, there was a follow-up survey or post-game questionnaire. And this is important, obviously, to understand how well it went and get feedback later. So, the final stage of that was re-evaluation. And as I've said, I've introduced the way that diet dimensions was played, and that was specifically for the challenge of sustainable food systems. But there's all sorts of ways that you can use this type of participatory social game in order to get to an understanding of, or at least build an understanding of some people in the room on a particular issue. So we've now taken this model of this debate style session, and we're using it in our maternal and child nutrition course that we run at LSHDM. Maternal and child nutrition course in LSHDM. So we have a master's student course that a specific module around maternal and child nutrition, and they have a session that's called Making a Case for Investing in Child Nutrition. And here, it works particularly well because we, number one, have a really interdisciplinary course in itself. So as all masters are, it's not just about learning what's on the piece of paper, it's about learning different perspectives and to a deeper level. We also, it enables the students to actually really nicely integrate what they've learned across the module into a practical setting. And it helps for them to make the link, as I said before, between research and practice. And it's also fun. So we always get the best feedback from this session every year we run it, because it's a step away from what they're sitting and learning and just listening to slides coming at them and making loads of notes, and it really allows them to consolidate what they've learned in a practical way. I'm going to talk about why we made it slightly different as well, just to give you an idea also about the kind of ways that you could potentially tailor it if you were to run the game. So instead of just making them come in the room and come up with a case, we created it as a bit of a role play game. So we had this imaginary country X, and we said the head of state had invited them all that day to come and discuss ideas around how you could improve child nutrition in country X. And each student was given a specific role and a specific goal. So they came in the session with their role, which would have been, a Minister of Health, a Minister of Finance, Minister of a stakeholder, a large business owner, a small-scale farmer, anyone that you could potentially think of that might have a role to play within this. And they each also had a goal that they had to try and achieve. So it's quite fun. A lot of time has to go into the initial time you set it up, I have to say. But after that, you've got all the materials, so that was good. We gave them facts about the country, made up facts, but the point was that we wanted them to look at the context that they had in front of them and really relate their project well to that. And instead of having this pre-great game questionnaire, because it's just a 3-hour lecture, they just had 5 different steps within that, where it was, again, the marketplace, which is really important to form the teams, project formulation, the battle stage, and discussion and feedback. And then finally a reward ceremony, because our MSc students, even though they're nutrition, they love chocolate, so it was very important that we had to give them some chocolate to reward them at the end. And again, we kept the criteria of winning around interdisciplinarity and feasibility and adapted, et cetera, et cetera. But we also, because we like to spread the love, we also gave other prizes for most helpful team, most innovative project, best teamwork, that type of thing. So now I've done a really whistle-stop tour through the game. The plan is for you to play it in the rest of what we have this afternoon. But instead of just playing it for either of these, we're not doing it for sustainable diets and we're not doing it for child nutrition. We're actually going to do it for a decision-making tool, or the use of a decision-making tool. And this is where we're experimenting a little. So you've heard about the decision tree that was used this morning in the context of livestock production. There might be other decision tools out there, or other ways in which you can come to a multiple perspective conclusion, or help to understand the different perspectives that exist within problems, because we all have our own things that we work in and our own things that we're passionate about. So what we're going to do is form 6 teams. And you can either use the policy tree, as discussed this morning. You can use collaborate, which is as the game here that we've proposed, or an adapted version of either of those, or something completely different. And we want you to come up with an idea with the hope that maybe someone might actually take this forward and use it within their own work, to come up with a proposal. Is that clear-ish? Nodding heads. This is good. We'll go along with it, and then if we have any problems along the way, just like we'll work on that one. So obviously, as with the other ones before, interdisciplinarity is key to this. And so we're going to do the same structure as we have with I do in the MSc course. And we're going to have a marketplace where you're going to make your teams. We're going to formulate the projects, and then we're going to have one battle stage where two teams will critique each other. And then we'll end with a discussion and feedback. And sorry, we don't have chocolate today. Sorry. But we've just had lunch, so it's probably fair. So the winning project in this case, rather than, it's not going to be as complex, but the winning project is going to just be one that's very interdisciplinary and developed through good teamwork, creative, and plausible, possible, or realistic. So one that we actually think someone might be able to take forward. So there's an incentive for people to really think about it. Right, now, this is probably not everyone wants to just sit after lunch and fall asleep, but we're going to have to get up, I'm afraid, and do 5 minutes of walking around the room, forming teams. We've got, sorry, you don't have to participate. 1, 2, 3. Well, okay, I reckon we can still do 6 teams. They just have to be quite small. So a table to each team, and 3 per team. Thanks, Greg. 3 per team. So that's nice small number. Okay. Ideally, your team should be based on people with different backgrounds, different expertise, and from geographically independent places. Ideally, but we won't be too forceful. Yes.
Three per team is not too small number to have background.
We could do 4. Yeah.
Reduce to 4 or 5.
And then 6 per team. Yeah. Is there 20 of us? Okay. So let's do 4 teams. 4 teams then. Okay, cool, perfect.
And the topic?
So the topic is you have to find, so your proposal, it's up to you entirely, but you're proposing in what setting would you need the use of something like this, and you want to come up, have a look at your project sheets for an idea of exactly what this would entail. But you want to come up with a proposal for, it could be like, it could be an example like we had this morning where in Vietnam you've got complex actors and systems that work. And so it's got to ideally relate to someone's research within the team. Or it could be that you work in an organization that's really struggling to decide which pen you want to use, for example. Something very, like, obviously that's an exaggerated, simple answer, but something that you can imagine you would need either the use of a live social game like Collaborate, and come up with that as an idea. Does that make sense? Kind of? We'll go with it and we'll see how we move forward. Yeah?
You have to mix, right?
Yeah, so everyone make your teams. You've got 5 minutes. Has everyone made their teams? Are we all in teams? Have we all got teams? Yeah. Okay. You've got now 10 minutes. Okay, so sorry, I should say it doesn't have to be sustainable diets, it doesn't have to be livestock, but you can if you want, bearing in mind that you're going to be rewarded for being creative or in what you think you could use it for, or in, ideally it would just like to relate to something that your team does. So if one of you feels, as I was listening to that presentation, I think that would really work for this, then go with that idea. Yeah?
So as everybody else.
Okay, everyone, that's the end of the proposal formulation. We're going to change the structure a little bit. Excuse me. No, if you get a damage point for talking, by the way, for in between. So we're going to change the structure a little bit because we actually have the time anyway. So what we're going to do, and it might help people to understand a little bit about how it works, what we're going to do is the front two groups are going to go through a battle and the back two are going to watch them. And then we're going to swap. Okay? Is that okay? No fists allowed, though, in the battle. Okay, just to explain what happens in the battle, and this will be relevant for everyone. Team A, and we're going to call you Team A at the front. No, actually, you're Team A there. Team A, Team B. Team A is going to pitch to Team B for a maximum of 5 minutes. You don't have to use all that time if you don't want to. Team B is going to discuss amongst themselves for 3 or so minutes, and then they've got 2 minutes to give critiques to Team A. Then Team A gets 2 minutes to think about a defense and come up with how they've integrated it into their proposal and tell them. And then Team B, if you want, you've got 2 more minutes to come up with suggestions, so nice positive suggestions. And then you'll swap roles, but we won't do that in live in the whole audience. We'll just do that one separately after. Yeah. Okay. How do you feel? Are we ready? Team A, I'm starting to time.
We go there or we stay here?
No, you can stay there. You can stay there and stand. Have you got a microphone? Okay. And when you're, I will flash at you if you're. I will flash my phone in the air. Thank you very much.
Okay, it works.
Cool. You ready, Fran?
Yeah. Off you go.
Okay, well, hello, everybody. We are Team A. Oh, sorry, yes, sorry.
Think about who you're pitching to.
Okay. So we're Team A. Our title is Food That Is Affordable and Nutritious. Acronym FAN. We hope you are fans. So a brief description would be kind of nutritional problems facing children from scheduled tribes in India. That's kind of multifaceted, many dimensions to that. The length or the when would be a 5-year project. A couple of reasons for that. The first would be to have a baseline and then be able to kind of track. It's a nutritional intervention to track any changes over time. Also, if there's educational components, we want to understand has there been an improvement in education? How long do I have, by the way? I completely didn't hear. Oh, really? Oh, I've been rushing. Oh, sorry. I thought it was like 2
You don't
minutes.
have to use it already.
Okay. I was completely racing. Sorry. And then, we have structure, a combination of education, which would have kind of more longer-term benefits, then also kind of more direct, immediate interventions. We haven't really. We did scope them a little bit, but this is because if there's issues around nutrition of mothers, education may have a bit of a lag, and there would be implications for the health of newborns in these communities if we weren't more direct. So that was kind of the where, the when, the structure. Goals of the project, we just about got a few. Increased availability and consumption of nutritious food, but we were debating about whether that would have to be biofortified, whether it would be locally produced, mainly fruit and veg. But then we were also talking about potential food from animal sources, dairy, if not then from more staple kind of pulse, lentil sources. Also then to facilitate that, helping to reduce the cost of agri-production within those communities, because they tend to be quite remotely located, sometimes quite isolated. So being able to help them there would be good. And then we kind of only have one main issue addressed, and that would be hidden hunger, not captured by statistics, and the poor quality of diets in these regions, particularly for children, for mothers, and so on. So that's as far as we got with FAN.
Okay, great. That's a great project. The only one thing I would say is that it'd be good if you could integrate the decision tree or collaborate into it.
Ooh, okay.
But that's perhaps
Sure.
my inability to explain the purpose of that. So what we're going to do is now you have your 2 minutes to come up with your criticisms. But criticize it as a project, not as yeah.
Okay, sorry, that was.
That's my way to explain it, right? I should have given examples. How would you know the suitability?
Okay, that's your. Now it'd be great if you could come up with your defense.
2 minutes.
2 minutes.
Go easy now.
Well, I think that the main criticism that we've thought is that we haven't really understood how the methodology of the project and how that links to the interventions that you propose and the tools that are suggested. That's the main, right? Yeah, and the consideration of the trade-offs. So I think that probably try to integrate those trade-offs in how do you then formulate your interventions based on that.
You have 2 minutes.
2 minutes. You want to continue?
Now you have 2 minutes to just think about how you want to rebut, if you want, or you can give more criticism if you want.
Yeah, just one point, because although the group mentioned that it's all direct intervention, what I see is more, as a nutritionist point of view, I see more of nutrition sensitive kind of approach, but that nutrition specific approach would be something to consider.
Any more criticism?
Just one extra that it sounded really interesting, for sure, but it's possibly very broad to manage in one intervention, kind of mother education, and somehow reducing food prices and affordability as well. But I'd be very impressed. Look forward to hearing more about it.
Okay, now Team A, you've got 2 minutes to think about how you're going to integrate their criticisms into your project. Yeah. Okay, they're ready for their rebuttal now, team.
So your question, the first question or critique, if we understood right, you were asking like where was the discussion around trade-offs and how did you arrive at what your project description is. So there, I mean, I think we didn't communicate that properly, but we were looking at different. Clearly, the diet is not adequate, and pregnant women care is not adequate, which is resulting in the problem. So if we want to fix that, if the diet is not adequate, then there are 2-3 things one can do, and that's where our discussion around trade-offs was. So one is enable them to buy food that is more nutritious. Second is, and then you have a kind of a branching off on the decision tree there. Second, do they enable them to grow food that is more nutritious? And the third, I think, was mainly these two. So it is after a discussion around the trade-offs there that we arrived at one, and I think it didn't come through clearly. There is a direct intervention, which is growth monitoring. First of all, pregnant women, are they gaining weight at the rate at which they should, and then growth monitoring of once the children are born. So that's the direct intervention. So right now in the program, if there is a child who's not doesn't have the adequate nutrition, then you take action right away. The other about the slightly long-term nutrition sensitive, as you called it, is the education for the mothers and the families about why it's important to have nutritious food and where they can get it from. Your question, I think, was you're trying to do too much in one project. I don't have an answer to that except we feel we can do it.
Positive. Okay, now you've got, if you want, 2 minutes to give suggestions to just how they could improve it. If you have any.
Probably, including, like, it can be an integrated kind of. It could be an integrated kind of a project where you involve the multiple stakeholders also, like the government agencies, NGOs, who are working in that belt of tribes. where you can actually give them all that benefits that is already in the system to the tribal population, at the same time leveraging on the existing food systems and the diets they have, how to improve it. Having a food-based approach would be something beneficial.
Okay. So now we've gone through one round of that. What we could either just go into. Are you two at the back ready to go into a debate? Yeah. Okay. Do it. And then you guys. Now it's your turn to pitch, and then you two will start as well. So they're going to pitch to you. You guys can pitch to, or do you want to do? Do you want to pitch? Oh, you want to listen? Well. Okay. Yeah. Do you want to listen? So maybe you guys could go now then and swap round. So do you guys want to pitch to this team? So you're team A, team B? Or are you okay to do it?
Okay, so the title, I can sit down, I don't need to stand. The title of our proposal is to use the ag nut tree to enhance nutrition in Singida, Tanzania, which is in central Tanzania. And we plan to do this, we plan to like collaborate with the participants at a community level so that they're here in the decision-making process. And we plan to do this in February when it's an off time for the farmers, so it's not too imposing on their lives. And the goal of this project is, as I said, to improve nutrition, but we want to do that through changing the food systems, so by using agroecology practices. And the way to, and we're in this design phase, like nutrition, like using this decision tree, we're assuming that a baseline has already been done, like to see what the nutrition status is of everybody there, so we can like use assign okay. So after the baseline has been done, we can then assign economic values to like the foods or whatever needs to be done with that. But then within the meeting with everybody doing this design tree, we can incorporate like their domestic and their knowledge of wild foods, so things that like are normally not assigned values in the markets. And then reasons why this project is tailored to the specific context is that we know that farmers in like this area of Tanzania don't really have a lot of resources. So we want to emphasize the participatory aspect to see what they know really works and to see what resources they already can use. Yeah. Okay. Yes.
Okay. So now you have team B. You have 2 minutes to come up with some criticisms of this project.
Yeah, so team A, can we ask a little bit? So we just were thinking about this decision tree. What actually were the variables? If you could a little bit more specify the variables, and also what if there was like participation of the community involved, in assessing the context and also hearing their voices. Yeah, but basically, what were the variables in context of this tree supporting the tool? And
I liked the idea of community participation, but normally as academics we approach the leaders and not people in the households who are really able to define.
Okay, so for your first question, so for your first question about what variables we're talking about in this decision tree, we were actually thinking that it was going to come from the community members themselves during this meeting. So like, because we were thinking of categories from economic to agroecological, like those type of things, but we really think the things that we're going to talk about are going to come from the community members. And then for who to ask, like who is at these meetings, we were thinking that there should be focus group held across different wealth groups within the community, as well as different language groups. But you ask those community members, like across both genders, like what those different groups are, so that we make sure everybody is covered.
Great. If you want, you can have some time to come up with any more suggestions if you have any, but you don't have to. Do you have any more suggestions or responses? Do you want to discuss? You done? Okay, well done. Yay, round of applause. That was actually a really nice, well, in my opinion, that was a really nice project, because that actually is something that could happen. Yeah, that project probably is there. Okay, so now, rather than doing it in plenary, you're going to do it. So the team who's not pitched yet is going to pitch to, so you guys pitching here, and then you guys pitching here. Maybe actually, yeah, I was going to say for the sake of it, noise, you guys should just stand back to the table.
So we come to you or you come to us?
Yes.
We have money, we are funded.
Firstly, I think we need to apologize because we've had the
The
benefit
mic.
of time.
We need a mic.
Do you need?
It's
I don't know if
okay.
you
okay.
if you use a mic, then
Yeah.
you just have to project.
Okay, cool. So we focused a little bit more on the decision tools side of it rather than the project side. But
Composition of your meetings and so on. We're wondering, is there anyone kind of from the engineering background, infrastructure background invited? That can be quite easy to rectify. We're wondering where was the kind of evidence for causes of diarrhea in children being caused by infrastructure? Can it be other stuff, lack of education, sanitation, etc., etc.? And then maybe our final one here would be, in terms of infrastructure and getting the government, getting ministers along and so on, and as it's a fairly big project, who would eventually be paying for this? You know, how feasible is it? Those are three or four things.
Maybe you can add something. It's very well known that you see, even you have good infrastructure in water sanitation, some of the places, in particular India, some of the areas, people don't just use it. Okay, so what is the solution to promote the use of the newly developed This sort of story from India, that's a big
I've heard of some available and nutritious energy dense food available while maintaining the safety of children in the humanitarian crisis affected region in Syria. Pretty tough topic, but yeah. So here we wanted to use both the tools. One was the collaborate tool that you suggested before. So this was basically to get information and on research and data that has been done in Syria before through international agencies that have worked in Syria and also NGOs that are on field in Syria right now. So we could get for safety, we could get hospital numbers and everything, and basically research done by other international organizations over there, and also use decision trees for development agencies that use that could use to allocate funding for these two issues that we have said here, which is where do I allocate my funding to? Should I use it for protecting humans who are at risk at a certain place? Obviously, like if a risky situation like that arises, then I would allocate it there. But I also have this issue of people who are in unaffected areas where children are malnourished, and I need to allocate food there as well. So a decision tree is what we thought could help, a tool like that, because in a crisis affected situation you need to take decisions as quick as possible, so probably developing a tool might help. And yeah, these are the two tools that we thought we could use. Should I? That's
Is that okay? Is anything else?
yeah, that's about it.
Hi, so our group was focusing on, oh sorry, there's a new title, a decision tool to address child diarrhea due to waterborne. Well, it's okay. It's based in urban areas of Ghana. It's based in urban areas of Ghana. The main problem that we're looking at is diarrheal disease in infants and children, and we're looking to reduce that through water sanitation and hygiene approaches. And our group focused on how to build a decision tool that could be used by local government. And so the first thing that we began with was a systems mapping approach to try and identify where the problems were, whether it was infrastructure or behaviour or other elements. The next phase of that would be stakeholder engagement. So through the mapping process, we would highlight areas that we need expertise from. So for example, government ministries and public health practitioners, behavioural scientists and local NGOs. And the outcome of that would be to build a decision tree that would highlight any trade-offs involved that could then be used by the government, as I mentioned. And we had some very useful feedback about who would pay for that and particular people that we would need involved. And so we were just discussing problems around whether it would be a public-private partnership. We have a new government ministry in Ghana.
Yeah, there's a new ministry in Ghana. That is Ministry for Water and Sanitation Issues. So we think that as a new ministry, it would be good to give them policy directions as to where to focus. So we think that this will be one of the tools that will be available to that ministry that will help reduce diarrhea amongst children. So that's why we come up with this kind of intervention.
Okay, thank you. Now, thank you everyone for playing that. What we're going to do now is have a discussion while Johanna and I are going to just talk about separately who we think is the winning project. But we just wanted to kind of review what we've done. Obviously, we did a very quick version of the game, and I don't personally, it was kind of suited to this problem, but it wasn't 100% suited to this problem. So what we want to do is maybe discuss why it wasn't suited, and also talk about whether you actually think that process was good or bad for sort of developing your interdisciplinary ideas. And then if anyone has, because we do have a wealth of experience here, if anyone has experience working in other types of tools, now's your opportunity to maybe share what you've done. So yeah, the floor is yours. Perhaps I start with, does anyone have any thoughts on whether this game worked as a way to formulate ideas?
It did actually. Like our team, we went around and got some people like from different backgrounds. Actually, what we could get was like to know more about Ghana and how the system worked there, and having a food safety person helped us in understanding what could be the potential sources. And as people who were from nutrition and other aspects of nutrition, we were thinking about even food handling, and then what happens at the household level, what happens at the unpiped kind of water sources. So it helped us, all of us, in some or the other.
Yeah, because I think that's something as well that perhaps you don't necessarily come out of it with like perfect proposals, but you actually just learn something that you didn't think you would learn today, which is always quite nice. So anyone, any more thoughts on that?
Yeah, I just want to add that, recently we worked with some colleagues from Australia using not completely new, but a kind of system approach they call system effect modeling. So to formulate a project, we come always with problems. What are the key problems? And from that we map out what are the factors that influence this problem. For example, why we have the bad healthcare system in country X, Y, and Z. And then what are the factor influence? Because you don't have income, less education, or the enabling environment is not working, too much corruption, etc. And we can map to another layer, the factor influencing the cause. And from that we kind of making a priority of different factors to target the intervention or asking just a question to further understanding. So I mean, it's something new that we experience in food safety as well.
that's really interesting because it's like coming the other way around, I guess, isn't it? Than starting at the problem things. So anyone else? Any tools? We do actually have to go away and discuss. So you can either talk about this if you want. You can talk about these things, or just discuss amongst yourselves. And we're going to decide who's the winning project and some feedback. So anyone? You okay? 2 minutes.
Which is a great idea. I'm not quite sure if, for example, they were saying like collaborate. I don't know when they were saying decision to
Okay, everyone. Drum roll. It's time for the reward ceremony for today's the winners of ANH Academy. No, so what we're going to do is we're going to just start with some points for each one, because it's really important, I think, to get feedback, and that's something, if you were to ever do this, use this game in your setting, just bear in mind, it's really nice to hear feedback for everyone. So I'm going to start with the team at the back. We both thought that the project itself was really nice. It's plausible, it's realistic of something that could actually work, and it would be really, really useful. And we really like the way that you were involving local community to come up with something that was really novel. So not just to just say, putting it on paper and involving them, but you actually were using them to develop the research as well. And then this team, so good, creativity and interdisciplinarity, and round of applause, round of applause. This team here, really important topic, really relevant for where a decision tree could be so useful. And so we rewarded you on that. And you also were good to take on criticism and suggestions and integrate that into the project. So that was really good. So well done.
Okay, this team here, they were a little bit unfortunate that they went first. And maybe we hadn't explained the aim of the game so well, but I think you guys worked really well as a team. You came up with a really creative project. We thought maybe the feasibility of it in terms of the scope, you were very positive about being able to do it, but I think maybe some of those ideas might need to be a little bit better fleshed out. But pretty good considering the amount of that you actually only got that 5 minutes at the start. So, round of applause. And this team at the front, again, they benefited from having a bit more time, but throughout the whole session, we saw that they were working really well as a group. So they really did have a very good spread of disciplines, and they all worked together to come up with a proposal that incorporated 2 different types of decision tools that were appropriate for each stage of the project. And then leaving the project open based on what the decision tool actually told them was really good as well. And I think that, it was a really good demonstration of a collaborative approach. So, the winners. So, a point that yeah, at the end we'll take a picture all together.
That used the final bit.
Yes, yeah. I just wanted to quickly say as well, but we only had a very short amount of time. So obviously you wouldn't use, you wouldn't take half an hour to develop a proposal. But in that space of time, you managed to get so far with your ideas already. And that back and forth, getting feedback at that time, I think is a really useful process. And so hopefully you guys appreciated that.
Yes.
Yeah, okay. And as we said, feedback is really important. We would really like to hear if you have any suggestions on how we can improve our learning lab, or anything that you got from it that was useful, any tips for us for future, and whether you would actually go ahead and use any of the tools that we discussed in future in your own area of work. And so hopefully everyone has access to internet, so phone or laptop? If not, can you maybe work together in your collaborative teams to make this work? We have a SurveyMonkey survey so that we save paper, and you guys can give your feedback directly. It's anonymous, so you can say whatever you like, and we'd be very happy to receive it. Thank you. Just give you the
and stamp your feet because we have to make it come out.
Everyone say, collaborate. Decision tree.